Hi, welcome everyone. Today we will study about Fournier gangrene. Let's start with our lecture. Fournier's gangrene is a fulminant polymicrobial infection affecting the perineal, genital, or perianal regions. It is characterized by necrosis of the facial planes and subcutaneous tissue. Although it was first described in young men without comorbidities, today it primarily affects older individuals with underlying diseases such as diabetes mellitus or immunosuppression. The condition is uncommon but severe. Men are disproportionately affected due to anatomical and hormonal factors. Mortality rates remain high despite advances in antibiotics and critical care, largely because of delayed diagnosis and rapid disease progression. Fournier's gangrene usually arises from local infections that spread along facial planes. Diabetes is the most significant risk factor due to impaired immunity and vascular disease. Even minor trauma or instrumentation may serve as an entry point for bacteria. The infection involves multiple bacterial species acting synergistically. These organisms release exotoxins and enzymes such as collagenases and hyaluronidases, leading to thrombosis of small vessels. The resulting ischemia promotes further necrosis and bacterial proliferation, creating a vicious cycle. As you can see here, causative microorganism, and you also can see the host defenses. Most commonly, it is a polymicrobial infection and commonly affects the immune compromised persons with diabetes mellitus, HIV infection, or a chronic alcoholic person. This is the classic picture of the Fournier gangrene, as this picture is showing discolored infected area with swollen genitalia and dead black skin. This picture is showing sloughing of the scrotum due to gangrene, as you can clearly see, and this patient then needed the debridement. Patient often present with severe pain out of proportion to clinical findings. As necrosis progresses, the pain may diminish due to nerve destruction. Gas producing bacteria create palpable crepitus, and the affected tissue becomes gangrenous with a characteristic malodor. It is a clinical diagnosis. While imaging helps delineate the spread, it is mainly clinical diagnosis requiring high suspicion. Delay for imaging should not postpone surgical intervention. The laboratory risk indicator for necrotizing fasciitis score can support but not replace the clinical judgment. Immediate management focuses on resuscitation and early surgery. Antibiotics alone are insufficient due to poor tissue penetration in necrotic areas. Surgical debridement is life saving and must be repeated as needed until healthy tissue margins are achieved. Later stages may involve skin grafts or flap reconstruction. Empirical broad spectrum antibiotics are started immediately to cover both aerobic and anaerobic flora. Clindamycin is specifically included for its antitoxin effects against streptococcal and clostridial species. Adjunctive therapies involve the use of hyperbaric oxygen therapy, which can improve outcomes by increasing tissue oxygenation and promoting wound healing. Maintaining good nutrition and strict glycemic control is crucial for recovery and reducing recurrence risk. Mortality remains high, especially when diagnosis or surgical intervention is delayed. Prompt recognition and aggressive management significantly improves the survival rates. Survivors may require reconstructive procedures for functional and cosmetic rehabilitation. Prevention revolves around managing underlying conditions, maintaining personal hygiene, and adhering to aseptic protocols during medical procedures that involve the perineal or genitourinary regions. So, in summary, Fournier's gangrene is a devastating but potentially survivable condition when treated aggressively. High clinical index of suspicion, especially in diabetics, alcoholics, and patients with immune suppression. and it is a clinical diagnosis, and ultimately it requires the surgical debridement and also needs multidisciplinary support to improve the outcome of this disease. Thank you very much for listening this lecture very attentively. I hope to see you in next upcoming lectures. Take care till that time. Goodbye.